Hello everyone, I'm Constandt. I'm the founder and the CEO of Ontoforce, a data science company based in Belgium, but also with offices in Cambridge, US and New York. But let me start where it all began. This is indeed, as the introduction was mentioned, this is the picture of my kid. So personally, I worked 12 years in a pharma multinational, before that as a bioinformatician and data architect, and I was a so-called expert in finding data for diseases on genes, proteins and stuff like that. But a so-called expert in the land of the blind kept on one eye as king. But the point there is, when I found out that my kid had something, I started looking to help him with the disease therapies and stuff like that, and it took me time. Because what's the problem? The problem is that data is not meant to be connected. We spend a lot of time Googling, and if we don't know what disease we're looking for, it's very tough. So what we did, I started myself coding an application literally at home, and my hobby got completely out of control. We founded Ontoforce, and what we do is we go beyond keyword search. Because as you know, you're adding keywords and making long strings, and it takes a lot of time to make scripts to get to data. We make it really simple for you to find data and going beyond keyword search, that in 8 clicks, you can find what you're looking for, maximum 8 clicks. I'll show you some screens. So we already have 11 of the top 25 pharma companies being customers, paying customers. And they say that they can find in 8 clicks what they're looking for. This is an example where people typically would take 3 months with 10 consultants to go to data. They were looking for ALS to find what ALS is about. You see the keyword in semantic search at work. It gives you all the synonyms, Garrick's disease, Charcot. Then in the second click, you can find the clinical studies or other information. All the data is brought to you, all the keywords are clustered. And then very quickly, in the 5th, 6th click, you have these dashboards to see, indeed, who are my competitors, where I'm looking for. And everybody can do it. There's no scripting, there's no coding. It's easy to use, very easy to use. So we patented also our software. So I've written the first patent, coded the first application, and then I surrounded me with even better people to do that. So we have great technologists in the company. And right now, let me explain our first flagship customer, Amgen. So they have around 100 applications, and they have all of these interfaces, and gluing that data, linking data silos together is tough. It would take them 6 months to a year and a half to do this. They had 2 to 4 data scientists working just on these 4 complex applications to find data, and it took on average 1 to 3 weeks to get to the data. With our technology, DISQOVER, we have one simple application on all of this data, and we go live after 3 days. After 3 days, there's already value. And everybody has access to the data, can make reports instantly. And also we link out with all the public data. So internal data and public data all at your fingertips. People call it actionable insights. The market of digital health is huge. We now focus on pharma, but we're also going to healthcare, much broader hospitals, and this can be ported into new verticals. That's why we're here to understand who can help us do that. The value proposition is huge. Just 100 users at Amgen, they say we saved them 3.1 million. AstraZeneca customer says if you use it on R&D, you can save 134 million. And we have now some companies where we're putting it from research into the clinical trial space, where we can even go up to savings of 807 million for one company per year. We won a lot of awards too, technical, business-wise. We were #1 mentioned as well by the VCs in Europe as in EIT, across all the ventures here. And to explain you our business model, we still have our open platform to heal patients, so we still do this on a daily basis. And that's where we gather a lot of momentum, and it generates 3 to 5 leads per day, so we don't need to do marketing. Then we try to get them into paid engagements. You see the logos there, these are paying customers. We get them an engagement product to test it out for 2 months, paid, and then we go to trial licenses and enterprise licenses, which go up to 600K to 1.2 million recurring right now. So as a company, we're based in Belgium. We raised money in Belgium, just one angel in the US. So we raised a total of 8.8 million so far, seed money and a round A. We're looking at a round B of 20 million because we want to even grow faster. With 29 people now, we want to grow by acquisition and we want to conquer the world. Our revenues last year was 1.5. This year it will be above 3.2 million and we're targeting above 10 million next year. So to capture things, our technology works. It's disruptive, but it works. It's not like the expensive data lakes. In 3 days, it works, and it delivers value. So ROI, If you bring one drug 1 day faster to market, you save a company $1 million. We can probably save companies 2 months to 8 months just in one line, so it's huge. And we're looking at deal making from 600K to 1.2 million to really scale up fast in B2B sales. So I want to thank you for your attention. Remember, we have a social impact. We want to help the world with smarter data and healing patients. We have a great business model, and may the Ontoforce be with you to unlock the power of your hidden data. Thank you.
Thank you. Thank you.